Okay, well, thank you all so much for being here today. My name is Diana Telipson Torres. I'm the UFW Foundation's Executive Director and National Vice President of the United Farm Workers Union. I'd like to welcome the farm workers and union leaders that are watching this event. We know that farm workers feed this nation. They're bringing fruits and vegetables and other crops to homes across the US, and farm workers have kept our communities functioning during the COVID-19 pandemic, and I really want to thank all of you for that. Quisiera decir las bienvenidas a las personas que están en esta llamada. Esperamos que estén aquí. Estamos ofreciendo una interpretación en vivo en español durante el programa de hoy, y consulte las instrucciones en el chat. Abajito de su pantalla puede ver el chat y también el mundo que dice interpretación. And so welcome everyone. And many of the farm workers who are on, have cared for those with COVID-19, have seen family members that have been sickened, who have gotten sick themselves. The COVID-19 vaccines could have a very big impact on farm workers' lives, and that is why we are here tonight. With 3 COVID vaccines now ready for use, each and every one of us will need to make our own individual decisions regarding vaccination based on the best information that's available to us. So we all know how important it is right now to be sharing information and answering questions around the recent development, distribution, and safety of the COVID vaccines. Now, tonight's virtual town hall event is co-sponsored by the United Farm Workers Union, La Unión del Pueblo Entero, Lupe, our sister organization in the Rio Grande Valley, PECUN in Oregon, Centro de la Familia, Cesar Chavez Foundation, Alianza Nacional de Campesinas, and California Rural Legal Assistance. So thank you all of these organizations for all of your support, your outreach efforts. We really appreciate your partnership. And now on tonight's virtual town hall event, we have the chance for you to hear directly from some of the experts on the COVID-19 vaccines. And we're joined here today by Dr. Janet Woodcock, who is the top official at the Federal Drug Administration. And the FDA is the government agency in charge of making sure that vaccines and drugs are safe and effective for humans. And then we also have Dr. Peter Marks. He is in charge of the department at the FDA that reviewed the new COVID-19 vaccines to make sure that they were safe and protected humans from COVID. We also have Dr. Margaret Kitt, who works at the Center for Disease Control, which is the agency that decides who should get the COVID-19 vaccines first. And we know we've been talking a lot about that and the prioritization of farm workers. So the CDC also helps states and local governments create plans to distribute the COVID-19 vaccines. And we also have a special guest today, Dr. Sara Bleich, who's the lead COVID-19 advisor to the US Department of Agriculture's secretary. So the USDA is the agency that provides leadership on food, agriculture, natural resources, rural development, nutrition, and related issues based on public policy. So thank you all for being here this evening. I know now we'll give Dr. Woodcock, Dr. Marks, and Dr. Kitt some time for short remarks, and then we're going to go to all of your questions here tonight. So now I'm pleased to introduce Dr. Janet Woodcock, who will explain the FDA's work on the vaccines.
Diana, really quickly, would it be possible to give the instructions to folks to switch over to the Spanish channel, if possible?
Oh, my apologies. Yes, of course. So for those of you who are online here, at the bottom of your screen, you should see a little globe. You can click on it and you get to choose English or Spanish. Abajito de su pantalla va a ver, se ve como el mundo, es un circulito que parece el mundo. Si presiona ese circulito, va a decir inglés o español. Para Spanish o español, nomás oprima español y vamos a tener intérpretes. I'll give it a couple seconds to ensure that folks are hitting that button there. Okay, thank you, Julie. So Dr. Woodcock.
Thank you and for having me and hosting this really important conversation about COVID-19 vaccines. Talking with consumers and patients regularly during the course of this pandemic to hear directly about the concerns and questions has been important to FDA, and I'm looking forward to our discussion tonight. I'm also pleased to see two of our government partners joining us for this discussion, Dr. Margaret Kitt from CDC and Dr. Sara Bleich from Department of Agriculture. I stepped into the role of acting commissioner of FDA in January, and at that time, I really have had a focus ever since on making sure that I support the work that the FDA's career staff, the scientists and doctors, continue to do in response to the pandemic. And I'm trying to support those regulatory programs in every way I can because it's so critical to the nation. Our agency is focused on using science to protect and promote the health and safety of the public. And so FDA has been working on combating the pandemic for over a year now. At times, it's really been a painful period, one that's caused our families and communities to change how we live, and it's triggered enormous economic and social disruption, including how and if we're able to work safely. And worst of all, this disease has led to many personal tragedies, which I've been hearing about over the last year. Now, the decisions FDA will make in the coming weeks and months with regard to new tests for COVID-19, new therapeutics, and new vaccines, as well as continuing to monitor how well the current ones work and their safety, will continue to be based on good science and sound data, not on politics. And these decisions will be made by our career staff here at the agency through our thorough review process. We're committed to be as transparent as possible about the scientific basis for the way we get these products onto the market quickly, which is called an emergency use authorization process. We want to make sure the public is confident in FDA's scientific review process and ultimately in using these products to protect themselves and to help the public. We've held a lot of public advisory committee meetings. These are scientific meetings, but they also have public comment periods for each of the vaccine applications that have been authorized. These committees are external scientific experts, both doctors and scientists, who review the data from the submissions and provide their own independent recommendations to the FDA related to the safety and effectiveness of the vaccines. And so we have independent oversight of what we do and input from independent experts. Before each advisory committee meeting, a couple days before, we post the documents that have all the scientific data, both from the company and the FDA's assessment on the web. These documents each are over 50 pages long, and they have a tremendous amount of scientific data and analyses, and they're available for everyone to see and evaluate as we go through the process. Now, when we took the 3 vaccines that have emergency use authorizations to the advisory committee, these independent experts, they overwhelmingly agreed that each of the three had benefits that outweighed their risks. And we got very positive input on these three vaccines. But for all three of the vaccine authorizations, FDA's career scientists conducted a fast but really incredibly thorough review of these requests for authorization, including looking at how the products were made, their quality control, their human safety data, and their effectiveness data, and much more. And our scientists and career staff have worked around the clock to really get this done quickly so that we can meet our globally recognized high standards for review quality, but at the same time, if these vaccines met our standards, to get them to the public as quickly as possible. Additionally, when we authorize these vaccines, we put important information out there to help any healthcare provider understand what was known about the vaccines, their benefits, their risks, and how to use them properly. We have fact sheets for the healthcare providers and fact sheets for those who get the vaccines, instructions for how to use, and all sorts of other guidelines have been made. So it's really essential that the public and healthcare professionals have trust in the FDA's review process and have confidence in the products that we approve or authorize, and faith in the fact that the FDA has a commitment to really protecting the public health. This confidence is particularly important now as we continue a mass vaccination effort in our communities. And as you consider whether to get a COVID-19 vaccine for yourself or your family members, I want to assure you I have absolute confidence in the team of experts at FDA and the thorough review they have done. In fact, they've done reviews of many vaccines over the years, including for infants and childhood vaccines. They're extremely experienced and have a vast fund of knowledge. And I have taken a COVID-19 vaccine myself because of my great confidence in the FDA career staff evaluation. So before I turn it over to Dr. Marks, I'd like to acknowledge the tremendous work over the past year that he and his staff have done to respond to the pandemic. Due in part to their tremendous efforts, along with the efforts of the industry and many other people in government, we now hold the promise to alter the course of COVID-19 pandemic in the United States with 3 effective vaccines. And so with that, I'll stop and turn it over to Dr. Marks. Thank you.
And Dr. Marks, before you start, let me just provide the instructions for the interpretation one more time, just in case folks have joined a little bit late. For those of you who are on your computer, if you can go down to the bottom part of your screen, there is a globe on the bottom. You can press English or Spanish. Estamos ofreciendo interpretación en vivo en español durante esta reunión, y si desea escuchar la interpretación en español, primeramente haga clic en la palabra more, M-O-R-E o más, o en los 3 puntos en la esquina inferior derecha de la pantalla. También puede seleccionar Language Interpretation, que quiere decir interpretación del idioma. Luego elija Spanish o haga clic en Done, D-O-N-E, o listo. Ok, de nuevo, haga clic en More, que quiere decir más, o en los 3 puntitos en la esquina inferior derecha de la pantalla. Y desea escuchar solo a los intérpretes y no a los oradores originales, asegúrese de hacer clic en Mute Original Audio, que quiere decir silenciar audio original. Todos deben elegir un idioma, no se quede en la posición de apagado predeterminada. ¿Ok? Muchas gracias. Y también está en el chat las instrucciones. Thank you for your patience, Dr. Marks. I'll hand it over to you.
No, thank you very much. And thank you everyone for joining this afternoon, evening. I just want to pick up my remarks where Dr. Woodcock left off. We do now have 3 vaccines available under our conditions for emergency use authorization. I can assure you that the conditions for emergency use authorization are such that they're very close to what we would normally use for a vaccine approval. These vaccines were studied in very large trials in a diverse population, which included both Black, African American, and Latinx people across the board in the age ranges. Um, and so we feel very comfortable seeing these vaccines being given to anyone who needs protection against COVID-19, which is all adults at this point. The vaccines clearly met our standard for safety and efficacy. And we'll continue to closely monitor these vaccines as they're given to millions of people throughout the country to make sure that there aren't any problems that come up as they're being given. So far, there have been no major problems that have come up. The one thing that we've seen were some allergic reactions in a very few people who get it, and that's why when the vaccines are being given, one has to wait about 15 minutes wherever it's being given just to make sure there's not any problem. Although the 3 different vaccines come from different manufacturers, they all work in the same way, which is they trigger the body into making one of the proteins that is on the virus, such that your body will make an immune response to that protein. And when the body then sees the virus, it's triggered to wipe it out. So that's the same way, whether it be one of the mRNA vaccines, that's the Pfizer or the Moderna vaccine, or if it's the adenovirus vaccine, that's the Janssen vaccine. Just so that everyone knows, they're all very effective in preventing people from getting into the hospital or dying from COVID-19. People should understand, and I think this is important to know, that in the short term after these vaccines, perhaps for a day or so, you could feel a bit tired after you get the vaccine, or you could feel a little bit like you might have a cold or a flu. That goes away, and there's no long-term adverse effect from that, but that's nothing to be too worried about. Obviously, if you ever got a very high fever or didn't feel well at all, you'd want to go see a health care provider. But feeling a bit tired after getting the vaccine is something that is not that uncommon. But it goes away within about a day. It's really important. I'll just finish my remarks by saying it's really important that as many people get vaccinated as possible, not just in this country, but around the globe, because that's how we will bring COVID-19 under control and hopefully someday actually make it go away entirely. That's called eradication. That would be a wonderful goal someday. But for right now, we can make a difference for all of those around us by getting vaccinated so that we bring this pandemic under control. So thank you for listening, and I will turn it back over now and look forward to questions.
Thank you, Dr. Marks. And now finally, I'm pleased to welcome Dr. Margaret Kitt, who will share how the CDC is working with communities to deliver the vaccines to people.
Thank you. Thank you for the opportunity to speak with you all today. My name is Dr. Margaret Kitt. I'm the Deputy Director at CDC's National Institute for Occupational Safety and Health. So worker safety and health is near and dear to my heart. But I also currently lead the essential workers team within the vaccine task force of CDC's COVID-19 response. This is really an historic event organized by a wide range of partners. And thank you to all the organizers who made this event possible in order to reach this very important group of workers. I recognize that there is a very diverse audience of workers, employers, and advocates attending today. As my colleagues at FDA have just discussed, in less than a year, multiple COVID-19 vaccines have been developed, put through clinical trials where they were tested for safety and efficacy, manufactured, distributed, and now are being administered. And as Dr. Marks mentioned, we now have a third COVID-19 vaccine, the Johnson & Johnson Janssen COVID-19 vaccine. This means more people can get vaccinated in more communities, increasing the overall population that is protected from severe disease, hospitalization, and death. This new one-dose vaccine is easier to ship, handle, and store, which expands access to harder to reach communities, potentially including farm workers. We knew there would be a few bumps in the road as the COVID-19 vaccination program was rolled out. However, public health experts across the country have extensive experience with vaccine distribution and administration and are working to quickly overcome obstacles. CDC is working with existing US, state, local, tribal, and territorial health departments to coordinate the distribution and administration of COVID-19 vaccines. Within CDC, the Vaccine Task Force Essential Workers Team focuses on vaccine implementation for essential workers through linkages with workers, industry, labor, and other stakeholders. Through this team, CDC conveys information about the vaccine to essential workers and supports state and local health departments with vaccination strategies for these workers. Daily vaccine doses administered continues to rise, with more and more doses given each day. As of today, March 4th, over 82 million doses have been administered across the United States. Right after the initial COVID-19 vaccines were authorized by FDA under the emergency use authorization back in December, CDC's Independent Advisory Committee on Immunization Practices, also known as ACIP, identified groups to receive the initial doses of vaccine while supply is limited. These groups included healthcare personnel and long-term care facility residents, like nursing homes, in phase 1A, frontline essential workers and adults 75 years and older in phase 1B, and the remaining essential workers, adults 65 to 74 years and 16 to 64-year-olds with high-risk medical conditions in phase 1C. ACIP used guidance on essential critical infrastructure workers from the Cybersecurity and Infrastructure Security Agency, or CISA, to define these frontline essential workers as those workers who work in essential functions for society and are at higher risk of exposure to the virus due to their work duties. And this includes you as food and agricultural workers. These recommendations ensure that people at highest risk from COVID-19 are vaccinated, in addition to being equitable and fair with these precious vaccines. I want to reinforce that while ACIP and CDC make national vaccine recommendations, each state has its own plan for prioritizing which groups will be vaccinated first. We fully expect that recommendations will be adapted locally. Our guidelines were never intended to be walls or barriers between phases. They are meant to support prioritization when supply is limited, and we expect that there will be overlap between vaccination phases, and some differences from state to state will exist. Many states and even communities are in different phases of vaccine administration. Right now, many states have expanded groups recommended to get the vaccine, including opening up vaccination to people 65 and older and frontline essential workers like teachers, first responders, and grocery store workers. We know in states like California, some farm workers have already been vaccinated. These various implementation plans are intended to maximize getting vaccine into arms while being mindful of those at higher risk for complications from COVID-19 because of age or because of higher risk of exposure due to their jobs. Successful implementation of COVID-19 vaccination requires a multi-phase plan with distinct strategies to deliver vaccines efficiently and equitably as more doses become available. One such strategy is CDC's partnership with chain and independent pharmacies and federally qualified health centers to increase access to vaccine in communities. Community pharmacies often have the unique ability to reach rural and underserved areas of the country, as well as minority populations, to increase access. More than 85% of the US population lives within 5 miles of a community pharmacy. The Health Center COVID-19 Vaccine Program, a partnership between the Health Resources and Services Administration, or HRSA, and CDC, has also recently begun at selected HRSA-funded health centers that specialize in caring for hard-to-reach and disproportionately affected populations. The goal is to address health equity in vaccine delivery by providing a direct supply of COVID-19 vaccines to health centers who serve these populations, including migratory and seasonal agricultural workers and patients who may have limited English skills. Finally, the Federal Emergency Management Agency, or FEMA, is working with CDC and other federal agencies to coordinate with state, tribal, and territorial authorities, private sector partners, and others to increase vaccinations in the US. This includes coordination efforts to establish and support fixed facilities and establishing pop-up or temporary vaccination sites and mobile vaccination clinics. It's important that essential workers get vaccinated as soon as it is their turn in a given community. Possible locations for vaccinations include a worksite vaccination clinic, a physician's office, a pharmacy, a local health department, or a vaccination site set up by state or local governments or local health systems. To learn what is available through your workplace, ask your employer if they are making vaccination available to employees. To learn about other options, you can contact your local health department or your personal healthcare provider. It's important that government, employers, labor unions, workers, human resource departments, and jurisdictions all work together to get our important agricultural workers the information they need about the safety and efficacy of the COVID-19 vaccines and to provide opportunities to get vaccinated. Thank you for all the work that you do on a daily basis. You are a critical part of our country's workforce, and I encourage each and every one of you to get vaccinated when it is your turn. It will help protect you, your family, your coworkers, and your communities. It's my pleasure to be here with you tonight, and I look forward to addressing your questions. So I'll turn it back to you, Deanna.
How about I unmute myself? Thank you so much, Dr. Kitt. I appreciate your comments. And now I'd like to start our question and answer session. And I know that Dr. Woodcock is ahead of the game because she already answered this first question, but wanted to see if you yourself have already received a vaccine, and feel free to jump in, Dr. Bleich, first. Have you received your vaccine yet?
I have not received my vaccine yet, but my parents got their second dose this morning.
Oh, that's wonderful. Oh, that's so relieving. How about you, Dr. Marks? Oh, you're on mute.
So I've had the first of my 2 vaccines, and I'm going for my second dose tomorrow. And I can tell you that I have older family members who are now getting all 3 of the different vaccines in their different locations. So,
and that just demonstrates that all 3
they're all fine.
As effective to prevent hospitalization and death. So that's good to hear. And then Dr. Kitt?
I have not yet gotten my vaccine, but that's not because I don't want to. I'm not yet eligible in my state, but I can tell you I checked that site every day to see when I am going to be eligible, and will be signing up as soon as I am.
That just goes to show not all government officials have received them. Not everyone's in the priority list just yet. So I know that we definitely want to get to your questions, all of you who are on this Zoom call. And so there are a variety of issues around the development of the vaccine, safety, efficacy, and then equitable distribution of vaccines. We've gotten a number of questions from throughout the country from farm workers, but we'd love for you all to hear directly from a farm worker. So first we have a question from Claudia Duran, and who is a farm worker. And Claudia, please unmute yourself and ask your question. Claudia, si pudiera poner su video, por favor.
Mi pregunta es si
Claudia, ¿puede
te
poner
puede traer consecuencias a largo plazo si te pones la
My
vacuna.
question is if the vaccine can have long-term effects if you get vaccinated.
Y Claudia, si gusta ponerse en el video, si no, está bien, pero si le podemos ver la cara. So whoever would like to address Claudia's question.
This is Peter Marks. I'm happy to. It's a very good question. To date, for all the vaccines that have been studied, there don't appear to be any long-term side effects of these vaccines. We wouldn't really expect them to have them, and we will be continuing to watch closely to make sure that we don't see anything come up as people get further and further out from being vaccinated. Right now, the longest cohort, the longest group of people have been vaccinated for about 6 to 9 months. And as we have people that are vaccinated for a longer period of time, we'll have more data to make sure that there really are no long-term side effects. But right now, top line message, we don't see any long-term side effects.
Yeah, and this is Janet Woodcock. I would add that we're seeing long-term side effects from the virus, from getting the virus. And we're seeing what they call getting, post-viral syndrome, or after the virus. We have people who are very fatigued for a long time, who have a wide range of symptoms. So getting the virus can lead to long-term side effects where we have not seen any of that with the vaccines.
So basically looking at it with Claudia's question is, it's worse to get COVID-19. In fact, the side effects that we're seeing from COVID-19 are so much worse than what we're seeing as far as the side effects from the actual vaccine. So COVID-19, it's no joke. So Claudia, yes. Muchas gracias por su pregunta. And I keep forgetting that there's an interpreter, but I keep wanting to switch over to Spanish, but did want to appreciate Claudia for asking her question. And now I'm going to turn to Henry Gonzalez. Henry, if you could please unmute yourself so that you can ask your question. And Henry is a UFW Foundation member from Washington. And Henry, if you could put your video on too so we can see you. Henry, si pudiera poner su video.
Hola, hola, buenas tardes. ¿Qué tal? No puedo con la
Hello,
cámara.
good evening. I can't turn on my camera. I'm sorry. I can't figure out how to turn on my camera.
Let's see. Abajito donde está, where the little video camera is. Oh, there he is. Perfecto, Henry. Órale, adelante.
¿Qué tal? Buenas tardes.
Hello, how are you all? My name is Henry Gonzalez. Right now, I live in the state of Washington, a town called Kennewick, Washington. And we are farmers who've been working in agriculture for 15 or 16 years. And to be honest, my point of view, I'd like to share my point of view and then my question. I'd like to let you know about how hard it is to work in the fields when you don't have any type of personal protection equipment, because the government doesn't pay attention to us. And we're in this condition for sure, but I really liked what Dr. Margaret Kitt said, the word about equity and equitable distributions. I think that has a great meaning and it's very important. So I think we need to recognize that part of humanity, that part of human beings where, yes, we might just be farm workers, but we're essential in this world so that people can enjoy fruit, and with this fruit and these vegetables that we labor physically with our own hands to harvest them. And this is important for everyone who works in the field because we are honorable people, hardworking people who came here to work in the fields. And because of that, I think we believe to be taken into account. And so now my question is very particular to my life, because today it's been 3 days since I started working in the field after testing positive for COVID-19. But I haven't been working because I have to quarantine. I've been forced to quarantine, of course. So my question is, after being positive for COVID-19, will I still be eligible for the 2 vaccines that there are, or how many are there? And also for the field workers, who would qualify for the vaccines? That's my question.
Gracias, Henry. Who'd like to take on that question?
I can start again. Thanks for that question. I'm sorry that you've had COVID-19, and I'm glad that you're getting better from it. Once you've had COVID-19, it's after a couple of weeks after, generally, it's perfectly reasonable to get any one of the vaccines that are available. I would say any one of them are reasonable to get vaccinated with. The reason why is that sometimes just having the infection will not protect you against the COVID coming back again. And right now there are different flavors of COVID that are going around. There's the original virus that spread, but there are now they're called variants. You can think of them as different flavors. And unfortunately, sometimes it looks like you may have had COVID once, but you could possibly get it again. By getting vaccinated, we believe that helps prevent people from getting it again, even if it's a different flavor than the original one they had. So I think it's an important thing. If you have the opportunity to get vaccinated, everyone above the age of 18, at least at this point, and probably by the end of the summer, it'll be everyone over the age of 12. But right now, it's everyone over the age of 18 is eligible to receive a COVID-19 vaccine at the right time as the vaccine becomes available. One of the vaccines is even available to be used down to people as young as 16 years old. But I would say when it comes time and one is available, it's a good idea to get vaccinated.
Muchas gracias, Henry. Thank you so much, Dr. Mark.
Gracias.
Okay, and so we have the opportunity to also get all of you who have other questions to put your questions in the Q&A little icon on the bottom. So if you have a curiosity, something that you're concerned about, please put your question there. Additionally, we had farm workers who submitted their questions through social media and through text message. So we also have some questions here for you all. So first and foremost, from a text survey that the UFW Foundation conducted very recently, where over 10,000 farm workers from various states responded, we know that 3 out of 4 farm workers want the vaccine. They were very clear that as soon as it's available to them, that they'd like it. And we also know that federally qualified health clinics, those community clinics that you all have been talking about, that are in rural areas, are among the most effective at getting vaccines to farm workers, but they're experiencing low supply. So how are you working to address this and to ensure that the states actually get vaccines to the places where farm workers live?
I'm happy to take that question, Deanna.
Thank you, Dr. Kitt.
So as mentioned, to ensure our nation's underserved communities and those populations that are particularly affected by COVID-19 are equitably vaccinated against COVID-19, HRSA and CDC launched the program I discussed a few minutes ago last month to directly provide a limited supply of COVID-19 vaccine to some HRSA-funded health centers. These HRSA-funded health centers are community-based and patient-directed organizations, and they deliver affordable, accessible, high-quality primary health care to many medically underserved communities and disproportionately affected populations, including some high-need urban areas, rural areas, and some frontier communities across the United States. The program is beginning at select HRSA-funded health centers that specialize in caring for particularly hard-to-reach populations. And these health centers will continue to follow state priority guidelines and reporting requirements. The initial health centers that were chosen for this program include those that serve a large volume of one of the following affected populations: public housing residents, migrant and seasonal agricultural workers, people with limited English skills, or people experiencing homelessness. So the first phase of this program will increase access to vaccines to over 250 of those health centers nationwide. And then as supply of vaccine continues to increase, HRSA and CDC will increase access to vaccine for more and more of these targeted health centers. Vaccine supply for these health centers is in addition to the supply that's being provided to the states. So this means that the supply provided for this program is separate from states' weekly supply. It's on top of that, making more vaccine available in more locations. Like other programs that have been recently announced, the federal government is providing vaccine to health centers as a way to really help increase access for these centers that serve the nation's underserved communities and populations that are disproportionately affected by COVID. HRSA and CDC will continually monitor the program to make decisions on including additional health centers as supplies increase. So hopefully that answers your question.
Thank you. And I think Dr. Bleich wanted to jump in as well.
Yes, I would just make 2 points here. One is there were announcements this week by the White House that the expectation is that by May, there will be enough supply for everyone. And I think that one of the hardest parts right now is everyone wants the vaccine and everyone's sort of waiting because there just simply isn't enough supply. But the hope is that by May, there's enough supply for everyone. I think the second point is that a huge priority for the administration is not just that the vaccine be distributed quickly, but that it be distributed equitably. And there's no trade-off there. And so there's a huge effort underway right now. And you heard some of this from Dr. Kitt to make sure that everyone who needs the vaccine gets access to it. And so while it doesn't feel at this moment that you can get the vaccine, there's a lot of work happening to make sure that everyone gets access to it as quickly as possible.
Thank you, Dr. Bleich. And I know we have continually getting this question on the ground, and I know we got a lot of questions about this. Do we have to pay for the vaccine If so, how much? And do you need health insurance? Who'd like to
Take
jump in?
that. Yeah, I just was having a hard time getting off mute. Sorry about that. The answer is no. You do not have to pay for the vaccine. The federal government is providing the vaccine free of charge to all people living in the United States. Vaccine providers can be reimbursed for fees by a patient's insurance company, or for uninsured patients by something that's called the Health Resources and Services Administration's Provider Relief Fund. It's very important to understand that no one can be denied a vaccine if they're unable to pay a vaccine fee. It is free to everyone.
And insurance, Dr. Kitt?
Yes?
Is that required?
No, it is available free of charge through this additional program that I mentioned, this Provider Relief Fund.
And one of the other questions that we're seeing as well is farm workers are asking whether it makes, what is the requirement for legal status?
So there is no requirement for legal status. We encourage vaccination regardless of whether you are a resident of that state or another state, or if you're a US citizen or not. So the CDC and the government do not make a distinction between any of those categories. And the different states, of course, follow their individualized plans, but there's no requirement.
Thank you so much. Now we have a question of someone who's breastfeeding a baby, and we also have a question regarding, actually received many questions regarding women who are pregnant. So can those individuals who are breastfeeding or pregnant get the vaccine, or one of 3 vaccines?
That's also another very good question. And let me make sure I'm okay. So if you are pregnant, you certainly can choose to be vaccinated. There's currently no evidence that antibodies formed from the COVID-19 vaccination can cause any problems with pregnancy. Women who are trying to become pregnant now or who plan to become pregnant in the future certainly also may receive the COVID-19 vaccine when it becomes available to them. There's no evidence that fertility problems are a side effect of the vaccine. And if you're breastfeeding and are part of a group recommended to receive a COVID-19 vaccine, you may also choose to be vaccinated. There's no data yet on the safety of COVID-19 vaccines in breastfeeding women or the effects of vaccines on the breastfed infant or milk production, but the vaccines are not thought to be at risk to the breastfeeding infant. But of course, we always continue to study this and put out new information as it becomes available. But I would say ultimately, if you are pregnant or breastfeeding and you have questions about getting vaccinated, really the most important thing is that you do talk with a healthcare provider, a physician, or other type of healthcare provider who can really help you make that decision.
Thank you. And we have another question regarding individuals who have other health issues like diabetes, hypertension. Will the vaccine affect their health?
This is Janet Woodcock. I would say that not getting vaccinated would really affect their health, that people who have other health conditions should be, really eager to get protected because they're at higher risk for having to go to the hospital and having a severe case of COVID. And so if you have these other health conditions, it's another reason to try, and as soon as a vaccine is available, to make sure you get vaccinated.
Wonderful. And just for those of you who have questions, please do put them on the Q&A, the little icon on the bottom. And I'm scrolling here through the questions and trying to see what we have not answered already. And I have a question here from Cesar, who's asking, he got the first dose of a vaccine and he got Pfizer. What happens if the second dose is Moderna or Johnson & Johnson? Can he actually do that?
So this is Peter Marks. I'm happy to take that one. Ideally, he should get the next dose should be Pfizer. He probably, hopefully has a little white card with him from after he got his first vaccine, and it will say that he got Pfizer. The goal would be for him to get Pfizer again. Now, if he had to get something else, they might probably the right second dose would probably be still Pfizer, but it would, if they might potentially try to give him Moderna. But the right answer is to get, if you've had Pfizer, to get Pfizer again. If you've had Moderna, to get Moderna again. And hopefully, if you tell the vaccine provider that where you got it, they should be able to have that second dose for you. They've been pretty careful to do that.
Wonderful. And then we have a question from Yuri. Yuri wants to know how much time does it take for the first dose to actually become effective? And is there a risk to contracting the virus once you have the first dose?
Yes, this is Janet Woodcock. What happens is your body builds up immunity. So over the first week or so, you probably could contract the virus, and your chances of contracting the virus go down every week after you've gotten, further away from, as your immune system builds up that immunity. So you should still have the same measures of social distancing and mask wearing and all the other things that people should do. Don't think the vaccine is, silver bullet that keeps you from getting the virus, but your protection builds up over the first week or so, several weeks. And if you have to get a second dose, if you're in the 2-dose vaccine, it'll build up further after you get the second dose.
Thank you. Okay, and then we have questions about continued questions about the efficacy of the Johnson & Johnson, because people are hearing that it's 72% effective, the others are 90-something% effective. And so one person here is saying, well, if you have a chronic disease, is it better to get one of the ones that has more efficacy here? How would you respond?
What I've been telling my actual own family members have been calling me about this, my close relatives, and I've been telling them, roll up your arm and get the vaccine that's available to you, because that will protect you. It is true there is higher, in the trials, there was higher efficacy of the Pfizer or Moderna vaccine, but all of them kept people out of the hospital and kept people from dying of COVID. So it is important to get vaccinated.
And I think, can I just add, I think what one may lose a little bit in efficacy, first of all, none of the vaccines weren't compared head to head. So we don't know exactly how they compare head to head. We do know that they all kept people out of the hospital and from dying of COVID-19. And there are some trade-offs here, because even though that efficacy number against moderate COVID-19, the kind that you get and stay at home with, is a little lower with the Janssen vaccine. It's a 1-dose vaccine, so you get it once and you're done. And people tended to be, a smaller percentage of people tended to feel tired after getting that vaccine. So there's a little bit of a trade-off here. I couldn't agree more with Dr. Woodcock, which is whatever the vaccine that comes your way, take it.
Absolutely. And I think just there's, I know that we had a lot of issues with weather and vaccines getting to certain locations. So we have a question regarding someone who was supposed to get their vaccine second dose, but it wasn't available. They had to postpone. So how long can you wait beyond, a certain time period to get your second dose if something is delayed?
So this is Peter Marks again. Ideally, it's not more than 6 weeks after your first dose, but I would say this, if it happens to be that it's not until 7 weeks that you can get back, still get the second dose. So ideally, if things work out best, it should not be more than 6 weeks. We know from the way it was studied that some people did end up getting it 6 weeks apart, and it seemed like things worked just fine. But what I would say to you is if it happens to be, well, it's 7 weeks, still go back and get the second dose.
Well, thank you so much. I know that we have many questions. We're going to have to do this again. I know that we're coming up to our time. We had a lot of questions from individuals who were farm workers, and then people who had family members or individuals who were not farm workers. And so questions about eligibility. So if you have questions, the UFW Foundation does have a call center. You can call our call center here. Ooh, look at that, snazzy. 877-881-8281. And you can call us Monday through Thursday, 11 a.m. to 7:30 p.m. And then on Sundays from 9 a.m. to 5 p.m. So any questions in areas where you might be eligible to get a vaccine, we will let you know. We also are helping individuals get registered for their vaccine. And so we can help you with that process. We know sometimes it's very complicated and confusing, but that's what the UFW Foundation's here for. I'd like to now hand it over to our wonderful guests so that you all can just give some final remarks as we're closing out here, and want to just say my appreciation for spending the time with us. So Dr. Bleich, would you like to say a couple words?
Sure, thanks. I would just say that from a USDA perspective, if I could leave you with one message, it's that we are very grateful for all the hard work that you do to make sure that we have healthy and safe food. And so we very much hope that supply catches up with demand, that you can get vaccinated as soon as possible. And in the interim, very much hope that you stay safe.
Thank you, Dr. Bleich. Dr. Woodcock?
Well, I can't say it better than Dr. Bleich. We're all really respect in the work that you do, and we are working as hard as we can to make sure that vaccine supply is as robust as possible and it gets to all of you. And I would just encourage everyone to, when you have the opportunity, get vaccinated so you can be and your family can be safe. Thank you.
Thank you. Dr. Marks?
The message is exactly the same, which is thank you so much for everything you do for us. It's incredibly appreciated. Please take care of yourselves, be safe, and when you can get vaccinated, get vaccinated.
Thank you, Dr. Marks. And Dr. Kitt?
So I certainly hope that the information we shared with you today is useful. We're very excited that the vaccine supply is increasing and becoming available to more and more communities. And it certainly is my hope that you will choose to get vaccinated when it's your turn, and that turn is very soon. So thanks so much.
Wonderful. And please, any questions that you have, you can go to our social media channels. If you're not part of the text messaging program, text message the word essential or esencial to 877-877. We're providing text message information through that so you can get the up-to-date information in your local area. Once again, I'd like to say thank you all to the FDA, to the CDC, USDA. It's wonderful to have 3 agencies here who have answers to our questions. We'll make sure to do this again, and we'll share questions for the future, and hopefully you'll join us. So thank you all very much. Have a wonderful evening, and thank you for all that you do. Muy buenas noches a todos y todas. Y sí se puede.